Hey, it's Dawn. I'm at my studio, so you might hear some outside noise. Okay, so I was asked to do a pelvic floor video, and I just want to talk a little bit about that. So, number one, I am not a pelvic floor expert. If you find that you have incontinence or pain when you are having sex, or some of the other things that might happen with pelvic floor, maybe prolapses. There's all kinds of different things that can happen with this. You might want to go check out or have a pelvic floor therapist check you out. I highly recommend them. They can be really helpful. And this is for males and females. So number one, a pelvic floor, it can be too tight. And if it's too tight, that can be a problem. Also, a pelvic floor can be too relaxed, and that can be a problem. So these exercises may not help you, and they might help you. I learned them when I was teaching, or when I was in one of my prenatal classes, I believe, is where I learned some of them from. So if they help, great. If they don't help, again, please go find a professional who works with that directly. Okay, so without further ado, you could be seated, you could be laying down, whatever is the best comfortable for position for you. And what I want to think about, so just kind of discussing about the pelvic floor, the way I would often think about it is, so the pelvic floor, it's kind of, whatever shape it is, but the front of it is kind of the pubic bone area, the tailbone kind of is toward the back, and then you've got, basically you've got a hammock, essentially, that's holding stuff up. Okay, so that's how I describe it. And so when we inhale, I would like for you to start off by thinking about, and if it's easier, again, lay down to do this, it's fine. Think about when you inhale, so the diaphragm has to drop down, so the pelvic floor has to drop down as well. So what I want to think about doing is, as we take a breath in, let the belly come forward and let the pelvic floor drop down a bit. So that's an inhale. And then as you exhale, everything rises. So inhale, down, soften, exhale, draw up. Inhale, downward, breathing in, exhale, lifting up. Another way that you can connect with the pelvic floor is to imagine that you are breathing through all of your orifices. So you're breathing through your nose, you're breathing through your eyes, through your mouth, through your ears, you're breathing through the pelvic floor, breathing through your anus. Breathe in. And then exhale and let that breath come out. And then just start to think a little bit more about breathing through the pelvic floor, lifting and breathing up. Or I should say, as you breathe, there's that dropping. As exhale, coming up. Breathing, softening. Releasing it. Okay, so that might give you a little bit more feedback about what's going on with your pelvic floor. The other thing, one of the things that I was taught when we did our training for prenatal, was to think about trying to pick up, this is so silly, trying to pick up blueberries with your pelvic floor. So you're probably trying to do it now. So you're trying to squeeze and lift, and then relax and release. So think about squeezing and lifting, relaxing and releasing. So the relax and release is as important as the squeezing and lifting. So squeeze and lift, relax and release. Now for men, and when I teach this in classes, men laugh at me. So for men, the lift might feel like, and I think this is brilliant, when you get into cold water and there's a lift of your scrotum, you've got that sense. That might be what you feel a little bit more of. So you're feeling that. Now we're gonna add another layer of challenge. Well, actually first, notice your shoulders. Are your shoulders up near your ears? If so, can you soften just with your practice? Just soften. Keep the shoulders relaxed, keep the jaw relaxed, keep nice soft breath. Now again, as you inhale, there's going to be the soft and down, and as you exhale, lift. Now, as you exhale, lift, you're gonna just hold that lift, or if you've picked a blueberry, you're imagining that you're squeezing, picking it up, keep breathing, keep the shoulders relaxed, and then try to go up a little higher, a little higher, a little higher, a little higher, and then down, 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 down. After you've done this for a while, you don't have to squeeze really anything except for the pelvic floor. You can get control over that area. And so as you go up with it and down with it, you can have that ability to really focus in on that area and not having to squeeze your glutes, not having to squeeze your abs, not having to use your shoulders. So let's dial it back. Let's go back to nice, easy breath in, belly coming forward because the breath has dropped down with the diaphragm is pushed downward. And then the pelvic floor drops downward. And then as you exhale, exhale that soft lift. And then just relax, take a moment in this space, notice how it feels, how you feel. See how that works. Again, I'm not a pelvic floor expert by any means, but those are some things that have helped some of my students, and I hope they help you too. Okay, thanks so much. Have a great day. Bye.